Mackenzie will tell you, yes, this is my normal tone of voice. I apologize in advance. I'm on the end of a cold, so I do have a drink here, and I know that's a no-no, so I'm sorry. I'm sorry. Okay. Why did I start out in healthcare? What got my mind going was my mom was diagnosed with multiple sclerosis when in my early teens. So anytime you have someone that you know, or if it's yourself, with a chronic condition, you go in, you hear nothing but medical terms. I'm first generation American on my dad's side, so for me, even being young, it was important for me to understand what those words meant, how it associated with the next steps in care for my mom, and basically her overall prognosis. Beginning at RCC, that's where I did. I am a graduate of the ADN program in RCC, and when I first got into college, I just thought, you know what, nursing's what I want to do. I want to help people, I want to make a difference, but I didn't really understand, nurse just meant nurse. I didn't understand all the different areas that a nurse can work. I'm going to get into that, and I'm sorry it's going to be nurse heavy because I am a nurse, but I am going to touch on all the, hopefully, not all, I can't do that, there's too many, but quite a few different areas in allied health that we can work and have careers. So, I love the title. ChatGPT did a great job because the titles of these missing guidance. When I was first starting, there was a class that I took, I think it was called at that time Nursing Strategies. And I thought, oh, this is going to be awesome because I'm a total newbie. I don't really know anything. I know no terms. And this is really going to help me. And it was part of the nursing core courses. So I thought, sweet. It's going to tell me all the different places that I can get a job or to study. No, that's not what it covered. So it was about understanding different like teaching styles and ways to hone your research and study skills so that you would be successful. It's important, and it was great to know those things, but that's not what I thought I was going to learn. So my first job was in the healthcare arena, was medical transcription. It was an excellent way to put that medical terminology that I had back here kind of into practice. A transcriptionist is, well, technically it's a medical scribe. I'm assuming that everybody knows what a scribe is, right? Somebody that writes down what the provider is saying and is basically a note taker. A transcriptionist, before we had anything AI, I was the AI. The doctor had a little, tape recorder, little tiny tapes, and then they would go through their assessment with the patient. They would do the whole interview, and then they would send me the tape. Then I would type in pretty much start to finish what happened in that appointment. So it was awesome because then all of those things came back into full force, medical terminology wise, and then I also got a sneak peek of the doctor's process. And I say doctor because I worked with doctors at that point, but the provider's process in their interviewing skills, what they thought, how they made that treatment plan, and then what the steps were from there. So I didn't realize that at that point, a lot of years ago, that was going to be my responsibility to be a provider and go from, transcribing to diagnosing and treating. It's important for medical terminology to be our universal language. That is what it is. We all have to have common words, phrases that denote different parts of the anatomy, position, orientation, and again, it has to be common. I should be able to describe something here in Medford and in Zimbabwe. They're going to understand what I'm saying because we all have to use the same terms. That's why medical terminology is so important. my son was a resident assistant in a skilled nursing facility. I promise there's not going to be a lot of stories. And then he worked in a skilled nursing facility. He was at the Manor. Then he was a CNA. And I would come home from work when I was already a nurse. I'm going to fast forward a little bit. Little Quentin Tarantino, just go with it. I would come home, tell the boys about my day, and we would have different conversations, just esoteric stuff. And then Mason's now in LPN, and he is currently in the Bridge program at RCC to get his associate degree. So it's kind of come full circle. It's very exciting. I love that. But he works at a high acuity floor at Rogue Valley, and so when his shift is over, he'll call and say, "Hey, is this what you did? What is this about?" And we're able to talk now instead of just little ideas or just small phrases. Now it's a full complex dialogue to another colleague. So it's pretty cool to watch that progression in a personal way grow through my son. So that's awesome. Now, CNA training. The CNA certification, it was a requirement when I was trying to get into nursing school. And it was an important first step. In my opinion, that was probably the best prerequisite that RCC could have had. I don't know, and I don't believe it still is a requirement. I think it's just volunteer hours. Somebody tell me if you have to be a CNA to...
You don't have to, but it definitely helps for your...
Yes, it does. It gives you points. Yes, it does. Which is why we did it. But also, it was helpful that way, but it was a requirement. I think it served a really good purpose that way because you were boots on the ground. CNA, that's the work of nursing. That's the work of healthcare. So if you took that 12-week course, you got your certification, you got a great job, and then you worked with people for a while, and then you went, wow, this sucks. I don't like touching people. I don't like people barfing on me. I don't, people are crying, they're in pain, whatever that is. That just saved you a lot of years and a lot of money. So I think that was a smart idea. They are, when I say they, I mean RCC. Sorry, everybody watching me. It's a great thing to have that certification come back to the Valley, because that's a big deal, and there's a lot of CNA jobs. So when I said that the CNAs, that's the work of nursing, it really builds that caring foundation, and that's what I feel like is the most important thing. No matter what level of healthcare you are at, care is still in the title, because you really have to want to work with people. You want to be of service, and you need to be able to not only balance that with your skill set, but caring has to be the foundation, and then you got to have the skills to back it up. Nursing pathway. So the progression, how did I get from there to now transcriptionist, then a CNA, certified nursing assistant? Sorry, that's also part of the confusion. Is there's so many abbreviations, and so when people throw those around, and everybody's like, oh, okay. So I'll try not to ad nauseum do it, but I'll at least tell you once. A certified nursing assistant, then licensed practical nurse. In the ADN program for RCC, after the first year, my class was able to take the PN NCLEX, so the practical nurse certification exam, so that we can work as nurses in the hospital. It was nice because then you got that bump in pay from CNA to LPN, plus then you're working as a nurse. The scope of practice, the things that we can do, I'll get to that in a second, is just a little bit different than a registered nurse, but it was nice because then it's just continues to build your confidence and your knowledge base. And then I got my associate degree from RCC as an RN, and then I worked in the critical care, the cardiac intensive care unit at Rogue Valley for 5 years after that. And it is, critical care is a fabulous foundation for knowledge, for just life in general. Evidently, that wasn't enough school for me. So I decided to go back and get my Bachelor's of Science in Nursing because my co-love with cardiac is surgery. And I wanted to be a surgical assist. That was a big deal for me. So I did my RNFA training, my registered nurse first assist training along with my bachelor's degree. That was a distance program, so I was able to do both of them. I worked with a surgeon who was getting ready to retire. He said, Nurse Reed, I need you for 2 years. I said, that's great, because that's what I need for this. So I was able to get all of my surgery hours and different things through him, as well as work in his specialty clinic. So I got a really great, I was the chief cook and bottle washer. I sterilized equipment, I washed the rooms, I was there holding patients' hand for injections, and then I was his assistant in surgery. So it was a broad base of things that we got to do. But you get to do that as an RN. Okay, so scope of practice in nursing. This is what I just touched on a little bit ago. It's basically the scope, like a microscope lens. All of the things on the inside are things that I am able to do because of my experience, education, certification. So a CNA is going to do an MA CNA. They're going to do a little bit different than an LPN, and then a little bit more as an RN, and then more in my next slide. So their scope of practice and roles, there's 2 different tracks that you can take. You can take a nursing track, which clearly I did, or you can take a medical track. The terminal degree for us is, it used to be a master's degree, now it is a doctorate. So a doctorate of nursing practice. I decided to stop at FNP because Oregon's a green state and I can practice independently here. So yeah. The other direction for the medical track is a MA, so a medical assistant, a PA, a physician's assistant, who is an upper level provider, their advanced practice, meaning they can diagnose and treat and hang out their own shingle. That's all that means. And then MD, medical doctor, DO, doctor of osteopathy. Both of those are physicians, the top 2. So this is, sorry, I should have clicked the slide first. So advanced provider roles, that's exactly what it means. When you're going to some type of a clinic or an office, they say, hey, the provider is going to see you in a little bit, because now it's not just the doctor is going to see you. For diagnosing and treating, that's all of us. It's FNPs, it's PAs, and then it's MDs and DOs. So a lot of different allied health opportunities. So CNA 1 and 2, if we're CNA, Certified Nursing Assistant, if we're CNA 1, that means pretty much we have to stay in a non-skilled environment. A skilled nursing unit or facility means that you have to have that CNA 2 certification, and I believe, hi, yes, please.
They got rid of the differentiation between 1 and 2.
I would hope so. Thank you. Yeah, and they needed to. So that's perfect, because that was never the case when I went to school as well. So I'm glad that that's not an issue anymore, because it was very restricting. So thank you for telling me. Medical assistant, RN, PA, LMT, licensed massage therapist. Anybody? No, my shoulders really hurt. Okay, good. So that's really awesome. There's so many different places that LMTs can work. I know you guys have to have hours, so get after it. I'll give you my phone number. Phlebotomy, people taking your blood. physical therapy, occupational therapy assistants, that's the program for here, that is in the next slide, and then a medical laboratory assistant. So lab meaning you are working in the laboratory as an assistant, but there is a degree that you can be running the lab. Sorry everybody. Hopefully that's a long enough slide to cover that drink. So the different RCC programs, you can see that it's basically what we had talked about already with physical therapy and occupational therapy. Those are masters and above if you want to hang out your own shingle for that. So for at least the programs right here, you can start with the assistant programs and then bridge on from there. I do like, and you don't hear about these things. It's kind of like your school counselor, like, why didn't he tell me about this? A registered dietitian, nutritionist, when you're in the hospital, that's a huge part of it. There's so many different facets of taking care of a human, right? We have to breathe, we have to eat, we have to, we have to have blood, and things need to be ticking appropriately. But for every body system, there's somebody that's taking care of it. So that's why I'm saying that there's so many opportunities for greatness. So that's what we need to, I'm trying to focus on that and let you know that it's big. Yes, please.
RCC also offers LMT training at the Grants Pass campus.
Fantastic. That's good. I have 2 areas to go and get students to work on me. Career paths that start at RCC are these here, and then I also are these here, but there's the only thing that isn't is a registered dietitian, nutritionist. I know there's a nutrition class, obviously, but this actual program is not here, so I apologize for that. I do like, and Cute Mac and I were talking about it, this program is near and dear to my heart. It's for a scrub tech. It is an associate's degree of applied science in surgical technology. So it is, it's a cooperative program with Lynn Benton. So in the operating room, you have surgeon, you have assistant, you have the scrub tech who does everything with the equipment, passing, handling. It's an excellent program. And it's also, if we go back to that working as a CNA, if that's not our bag, hanging out with live people and touching and doing all the fuzzy stuff, this is just like a step back from that, because in 3 minutes the patient's asleep, right? So you're not having to deal with that. That's our problem to deal with. But it's kind of nice because you're still, it's instant gratification. Hopefully the job that you're doing, the surgery that you're doing is positive, restorative, palliative, any of those things, so that you're making a difference that way. There is also a monitor tech. Oh, so fantastic. So it's telemetry monitoring, so it's the cardiac rhythms, right? You know, when you get in the hospital, they put the leads on you. Even a 3 lead is what you would have on the floor. There's somebody behind those monitors just watching all the ECGs go. So, and I called Mason to make sure, and he was at work, and I said, hey, go to the monitor tech and see if they went to school. There are like technical schools for monitor techs, you can do that, but you can also be an MA or a CNA, do a little quick cardiac rhythms class. I need you to get the hook out when I'm done, yeah. If I'm taking too long.
Okay.
Yeah, Tony, I'm looking at you.
Good. No,
Yeah. So they're timing me, and she's done. So, but if you just do, if you're already working in the hospital and that's something that appeals to you, it's kind of nice because you just take that quick cardiac rhythms class, and then it's on the job training. So, also again, back from direct patient care. It's nice. Nobody's sneezing on you out there. Work settings, SNFs, skilled nursing facilities. A skilled nursing facility is usually inside a retirement home. right? So any of these places, the Manor is obviously the biggest and the first one that comes to my mind. The Manor has just resident housing for the beautiful people, and then they also have the skilled nursing facility for residents that then are needing more or definitive care for a long time. But any of those rehab centers, or excuse me, skilled nursing facilities, those units can work as rehab centers. So if we have somebody in the hospital, okay, it's taken a long time to recover, we need some help, we can't go home and do it, it's not safe to go home, then you go to a skilled nursing center. So there's different levels that you can do if you want to work in a skilled nursing facility. It's not just working with our geriatric population. Urgent care, certainly. Hospitals, obviously. Different specialty clinics, infusion centers, dialysis, mental health and recovery centers. So dialysis is not really something that I thought about. I had a friend who had worked there, and I went, oh gosh, that's right, they do need nurses. So dialysis, excuse me, relies heavily on CNAs and technicians because the treatments, they take 2 to 3 hours at a time. It's 3 days a week. DaVita is our local one, and it's also nationwide for people who are in kidney failure, and we need dialysis. We need that filtration. So that's a great option as well. I like that one. And then different thing, and I'm trying to kind of touch on things that maybe aren't in the mainstream. If you're like, dude, why is she telling us about dialysis? That's why, because these are things I had to find out later when I had already was established in my job, and maybe my mind would have gone somewhere different. So that's why I say it. Pain centers, there's a few different pain clinics, which they do a lot of different cool treatments. So they need CNAs and MAs as well as infusion centers. Infusion is going to be IV therapy, antibiotics, fluids, different medications, sometimes chemotherapy. Specialty clinics, like we said, every body system, anything that you see, there's a specialty clinic and provider for it. So there's always a job there. You name the organ or the orifice, and there's a place for you. So my current clinic, I work at the Allergy and Asthma Center of Southern Oregon. We are allergy and immunology as well as an asthma specialty clinic. We have MAs primarily that work in the clinic that start to finish. They are there to greet the patient room, vital signs, skin testing, sometimes skin prick testing on the back, intradermal, little needle makes a wheel, intradermal testing, as well as sub-Q injections for our allergy shot patients, and then asthma diagnostic testing, scheduling, as well as education. We do have CNAs that come in, and we make them into MAs. But we have CNAs that come in. I like that part of it because usually for that certification, you have had to be in some type of a healthcare clinic setting. So it's nice because you usually can look and, assess somebody pretty quickly of what's going on. And you have usually some patient care skills already. And then we did expand it to some veterinary techs just because they had, one of them was related to me. I know Mackenzie. Because they have experience with direct patient contact and quick assessment skills for little critters that can't speak to them. So we liked that part of it. Patient care flow, like I said, there's a lot of different facets to be able to deliver care. Each department or specialty, we all need to work in coordination to provide the relevant data from wherever you are, so that we can make a cohesive treatment plan, and hopefully that means a successful outcome for the patient. So every every link in the chain matters. This is another one that I'm not really sure why it was named this. Soft skills in healthcare. If you listen to me speak, this is not a soft skill. So communication. That's the biggest thing. Communication, professionalism, emotional resilience. I do like that part of it. You need to be able to care for your patients, but also care for yourself and protect your heart. So whether you're working with patients or other staff members, clear thoughts and idea sharing, that's a big deal. My biggest soapbox moment is about where we receive our wisdom, our pearls, or whatever you want to call it. So there can never be ego when it comes to learning, because you're going to find knowledge everywhere. Whether you walk in here, you walk into the doctor's office, you walk into a patient room, somebody has something that you need, that you can add to that little Rolodex, don't make fun of me, that little Rolodex of knowledge that you guys are always adding to. So you be open to receiving the wisdom, and you just add it to your practice. That's it. It's just another tool in your belt. Well, clearly this talk is going to have a lot of Mason in it. Mason's my son. So I always tell him, and especially as he was going through school, I have been a preceptor a lot, obviously. I've been a student a lot. And you never want to hear, yeah, I know. Yeah, I know. Oof, no. So I always tell him, I said, dude, don't be that guy. It's a yes, thank you attitude. That's what you want. Hey, did you know that the sky is blue? Oh, yes, thank you. Yeah, thank you. Great. That's great. It doesn't matter. We all know it is. But you take it in and you move on. You add it because the next statement or the next pearl is actually going to be life-changing and mind-blowing. So just be open for it. So back to I'm looking at kind of entry-level careers, so starting with a CNA or an MA. Both Providence and Rogue Valley, and I call it Rogue Valley because that's what it was. I refuse to call it Asante. Okay, Asante Rogue Regional Medical Center for the internet. They do have tuition reimbursement. It doesn't necessarily have to be allied health driven, but it'll help because they need to know that it's going to further the cause. So there is tuition reimbursement. It's awesome. And then there are some Bachelor's of Science in Nursing programs that will pay off your student loans, but you have to in turn work 2 to 3 years in that facility, whatever that facility is, in order to pay that off. It's amazing. Unless you want to move, then that new guy needs to buy out your contract, or you have to pay it at whatever level it is now. So be mindful of that. But tuition reimbursement, always a great thing. And most healthcare facilities, they're going to work around a school schedule. I know that we've had a lot of employees for us that are wanting to move up and do something different in their career and adding to their education. So obviously a hospital or some type of a skilled nursing facility, something with a 24-hour clock is going to be a little bit easier because nights or weekends they're going to be able to accommodate you a little bit better. So career growth pathways. Start small. I was just typing on my computer, listening to my baby cry. That's what it was. And then there isn't a correct path, right? If there was, I would have been standing here 10 years ago. So yeah, sometimes you just grow where you're planted. So every role matters. Like I said, all of us make up that picture of healthcare. Everything we bring to the table is important and it's necessary. But work in the environment, that's going to be the take-home message. Work in the environment that you want to be in. It's it's just like learning a new language. If I really want to speak Italian, I need to move to Italy, right? The longer you're there, the easier it is. Buongiorno. The easier it is for you to just start thinking in that language. My first day of nursing school, people obviously who had worked in hospitals, you know, they're saying this and that, and they're using all the abbreviations and meds this and and I'm thinking, oh my Lord, what are they saying? And so it was a little bit scary that I had invested time, and now here I am, and everything's Greek to me. So, and I don't speak Greek. So, it is so much easier to just be immersed in that world, and then it becomes second nature, and then you are fluent, and it makes things click into place a little bit more. That's what they were talking about. Oh, that's why we do that. Yes, Ted Hoes are important. Yeah. All right, guys. Thank you. What can I tell you? Nothing? Seriously? Okay. Yes, please. Come on, one of you.
For the purposes of tuition reimbursement, what's stopping them from, you said that the...
Oh, don't quote me. Oh, don't quote me. The reason that I know tuition reimbursement, Providence, it was, what was he? He was a sterile processing tech. He was a sterile processing tech. He was going to get his certification, so they paid for those kind of offshoot classes. And then my son, we've talked about him, it's Mason, he is in, they are giving him a reimbursement for his tuition for school here, for sciences.
Is that on like an additional, we'll pay you this much extra towards that per hour, or is it at the end of your contract?
No, you pay for the school, they cut you a check for whatever the allotment is.
Okay.
Yeah. Ma'am?
So it's for the tuition and reimbursement.
Oh, see,
Because I
look.
work at Providence. If you work at Providence as a part-time or full-time employee, you get $5,200 per year to use. And how they use is that it's either through the school that's authorized, or you pay out of pocket and you reimburse it through Guild, and you get it through your paycheck. If you work at Asante, if it's part-time, it's $1,500. If it's full-time, you get $2,500 tuition reimbursement.
See, look at you
And
go.
then with Asante, you have to be there for more than a year, and you have to be either part-time or full-time.
Nice.
Providence, I think, is 6 months.
Oh.
I love it.
Is it 6 months?
I think so, yeah,
Yeah,
because
so
I was,
Asante.
I think I jumped into that one a little bit.
I was there right at 6 months, and I got my classes all paid for last term.
Yeah.
My
Nice.
main purpose of that is there something stopping them from, say, firing you like a month before the end of a contract so that they don't have to pay the reimbursement? Is there a protection for that?
Not
Not
for.
It's not really a contract.
No.
You pay
It's
for
just-
the,
it's-
yeah.
It's just a perk.
Yeah, it's a perk.
It's a
Just the
benefit.
benefit.
Yeah,
that
just
you
a,
get.
yeah.
Yes, ma'am.
I have a question. Well, kind of just like words of encouragement or like just ideas or advice you give like mothers and people that have fathers and people that have young kids and families. What did you do to kind of balance like school and having a family?
Oof, that's a good one. My family went to school with me, no joke. My son, the first go around, my son was 2, and my husband was a rock star, and he really, if I didn't have the family that I did, I would not have been able to do it. So hopefully, if we are a single mom or a dad, we've got some type of support system, because otherwise it is difficult and expensive on a good day. And that's exactly what it was, is that I had my nose to the grindstone, and I was able to enjoy my family in big chunks. And then my husband took care of my son while I was studying. So, and then as Mason got older, then we basically studied at the same times and competed for better grades. So yeah, it's truly it's family support. Ma'am?
You talked about like green states.
Ooh, good one. So for advanced practitioner roles, which that's me, and technically I don't know about the PA. So a physician's assistant, they are a dependent provider, so they always have to have oversight from some type of either MD or DO, right? A physician. So for green states, in Oregon, and I don't know all of them off the top of my head, but quite a few are green, and Oregon is one of them. A green state means I can graduate from FNP school, I can go hang a shingle, and I can diagnose and treat, and that is my clinic. There is no oversight for me. The buck stops with me. So it's pretty awesome. And then there are other states that are yellow that need the NP providers need a little bit of oversight, and don't quote me because I don't know what that means, but a red state for sure. And California is a red state, as last time I checked, that you have to work in a clinic, and it can be, I think an MD can have 3 or 4 different clinics under their purview with different providers providing care.
So then a follow-up question to that, is there a scope of work that you can't perform as an NP that an MD does?
Nope.
Nope, you can still do everything you do.
Yes. Oh, wow. Okay, no more follow-ups to that, I promise. Okay. Yes, Sam?
Mine kind of goes along with that, but as a surgical assist in the OR, what's the top of your scope?
So, that's an excellent question. So the top of my scope, basically I am, the word assistant is the biggest thing. So it's whatever my surgeon trusts me to do. So that comes with time, experience, and rapport. Neuro, besides brain surgery and cardiothoracic surgery, I work with every other specialty. And so it depends on how long you and I have worked together, what you trust me to do, what I'm able to do. It's hemodynamics. We're trying to keep, blood loss to a minimum, do the best that we can, and then close you up. So it really is surgeon dependent.
Is there a downside to the green state situation as an NP? Like, can somebody sue you if something goes wrong?
Of course they can sue me. They can sue me now.
Is there a downside as opposed to other states, where you have?
No, if you're going to get sued, you're going to get sued, right? Your name is going to be on there, whether it's a red state or a green state. It's just going to be Dr. Smith and then Joanne Reed. My name will just be right under on the suit. So, not really. It's called malpractice insurance. Yeah, I mean legitimately, yes. Yes, please.
You said you own your own clinic, correct?
I own my surgical assisting. I work at the Allergy and Asthma Clinic.
I was going to ask, how does your schedule work being able to go through both of those? Like, how does
work at both of them?
reach out to you to do a surgery when you're already working full-time at a clinic?
Oh, that's a great question. That's a great question. It's one I ask myself all the time. So I used to have a business. Well, it was my only business. And then COVID came, and then Mama needed to buy some bread and milk. So that's when I got the job at Allergy and Asthma. They are fabulous, and we get days off, during the week. Plus, we have an abbreviated schedule on Friday, and then I can put myself on call on nights and weekends. Yeah. So that's why. But there's not just a flyer with my name on it. I'm already established with. I'm just kidding. I'm already established with those offices that I work with. That's how they call me. Yeah. Okay, hold on. Yes, please.
So for being a nurse practitioner,
Yeah.
I looked at some programs for it. It says that you need to have 2 years of
Critical
nursing
care.
2 years of nursing experience before you can even apply for a nurse as a nurse practitioner. Did you
Yes.
have to do that as well, or?
Oh yeah. Well, but I already had
Oh.
5 years of critical care. That's what I did right out of, well, I don't expect you to remember slide number 2, but that's what I did right out of my RCC nursing school. Yeah.
So would you say that because you knew what kind of nurse practitioner you wanted to be to get the
No, I didn't.
Oh, you didn't?
No, I didn't. Mm-mm.
Oh.
I had no clue. That was not in my mind at all. Right? Remember when I said I was transcribing and typing and crying? No. Had no idea that someday this would be the definition of who I am right now. Not a clue. Not a clue. It just worked out to be that way. I would not have changed it, and absolutely you need some type of nursing experience under your belt to be able to do this job. Absolutely. Yes, ma'am.
What is the range as far as types of nursing experience that you can get those 2 years?
For my program, I went to Western University of Health Sciences in Pomona, the lovely Pomona, California. Our program said 2 years of critical care. That's ICU or CCU only. I don't know what they are now. I don't know if it's just like a higher acuity floor, like a step down unit where I
Even ED or anything.
right? I don't know. Sorry, that's a question mark. I feel like Professor Google is going to be your best help on that. Yes, sir.
Given the current landscape, if you were to do it again, is there anything you would do differently in your school?
I would have stopped. Yeah. That is fantastic. That's a great question. The reason that I went on to an advanced practice role is because I was losing clients. I needed to be able to bill appropriately. Okay, I'm looking. I needed to be able to bill appropriately, Medicare, some managed care, different things like that, and that's strictly for my assisting business. I needed to still have a business, and they were only going to reimburse not for a nurse assist, but for a provider. So that is the reason why I went originally, because then surgery became my new love, and I wanted to keep doing that. So it wasn't until a year into it that I realized that a surgical assist doesn't count as a diagnosing and treating provider. And that's what I have to do to keep my certification as a family nurse practitioner. Practitioner is in the title. So I don't know. That's a hard one because it absolutely changed. I cannot work as a registered nurse anymore. Like during COVID, I couldn't just, jump in at the hospital and help out there or do anything else. No, because now this is what my scope, right? Remember when I said we've got the scopes, it's here and then here and then here, and now my scope is here, and I can't go to working as a floor nurse because I'm the one that's supposed to be at the top saying, gosh, let's do this. This is what it is. This is what I know the diagnosis is. So it changed. It absolutely changed my entire nursing practice. Okay. No, go ahead. He's telling me 5 minutes, and then I got to get to getting. Yeah.
So what you just said was you can't go down? Does that mean like they literally won't hire you, or?
No, that means literally my scope is above that now, and I don't say that in a snotty way. I'm just saying that the scope of my practice means I can only take jobs that have or at a practitioner level diagnosing and treating. I know, I kind of, yeah, especially when I needed a job, I was like, hey. Yeah, hold that thought. Yes, please.
I just was curious, as your experience as an NP in a specialty clinic, do you require extra classes, training, certification to be specialized, or is it the same as a family nurse practitioner in general care?
No, it's that's also fabulous. No, you just know that you're going to be new for the first year again. It is not any specialty training that you get from a school or a certification. It just means that it's on the job and you've got to learn what that clinic does. Hold that thought. Yes, please. I think you were next.
Yes, I think so. What is something you would, advice-wise, give to yourself, younger you, going through school with these hard times during nursing school? Because it's not a piece of cake. Like, what is something you would recommend saying you would say to yourself during it?
I'm almost done. I'm almost done. I'm almost done. Eyes on the prize, right? Eyes on the prize. So if we're going to do it, it's going to be hard. I don't care if it's the best environment. You have the most money. You have the most family support. You focus. You get it done. You bust through it. Please don't take 9 years to get it done. Do it as safely and as quickly as possible, because you know that's the goal. So I wanted to help people. I wanted to have a good job, and I wanted to be able to take care of my family. That's why I did it. That's why I busted my butt to do it. Okay. Yes, please. Yes, we were over here.
Is it me?
I think so.
Oh,
I went like this.
So
I think it's you.
there's one behind me.
Yeah.
Okay, so I'm a surgical tech.
Oh, yay!
Yay! But I was just wondering, why do you think they don't recognize surgical tech as work experience towards the nursing program?
That's an excellent question.
And I feel like I could plead my case.
I feel like you should plead your case.
I'm going to.
No, you
I
shouldn't.
want to hear what you say. What do you think?
You have a bird's eye view of anatomy and physiology, and you are standing next to a medical doctor and a surgeon who is able to answer any questions that you have, and you are seeing the body in the best or worst working order. So, I mean, literally, you have the most hands-on experience.
Thank you.
Right?
Okay, yeah.
So, yeah, I'd be pleading it. Okay, yes, please.
So, just for clarification's sake, surgical assistant is at the RN level, not at the practitioner level?
No, my RNFA, my first assist as an RN. Yes, working in surgery. That's what you're asking me?
Yeah.
My NP trumped the RNFA, but that's still my title, is a registered nurse first assist. So I had that, and then my NP just kind of.
Could you be a surgical assistant as an RN?
What? Yes. You do have to go through school, because why wouldn't you? Yeah, so you got to pay for that school, but it's a good one. Last but not least.
As far as applicable work experience, I was a caregiver for 2 years at a level 3 adult foster home, but I wasn't a CNA. And I've also been a massage therapist and a structural integrator. Do those help?
I would assume so, but I am absolutely no expert. So I'm sorry about my deficit there. Yes, please.
Do you have a personal touch to keeping patients' autonomy and respecting their independence?
Do I have a personal touch in helping them keep their autonomy?
Yes.
Yes. I'll ask what you want to do. It's my job to, like I said, get all the pieces together. We figure out the puzzle, and I say, okay, these are the options. What would you like to go with? Any time, and especially in the clinic that I'm at, hopefully it's black and white, but even if it's not, it doesn't matter. I don't tell you what to do. We talk about it, and then you tell me what you're willing to do and what's going to work the best for you. Okay? Yes, sir. Professor Cremo, I promise that I'm walking.
It's perfectly fine that if you go over.
I'm
as long
walking
as
away.
you don't have somewhere to be.
It's okay. I'm only going to get a parking ticket in 15 minutes, so it'll be okay. Yes, sir.
So I'm a little bit of a late bloomer in this industry, as you can imagine.
Yeah.
I'm actually looking at going
if you're able to move out of the area to go to school, I would not do a doctorate program. It's long, it's convoluted. Go baby.
No, I'm gonna go NP.
Right. So the only program around here is a DNP.
Oh, okay.
It's through SOU.
Oh, I thought that
They
was a
stopped-
master's program out there.
Yeah, they stopped providing that. It's now DNP.
Oh, no kidding.
So if it's me, I'll go somewhere else. Oh Lord, what? It's gonna be written on a bathroom wall somewhere, isn't it? Joanne's lecture sucked. Yeah. So that's what I would do.
Yeah.
It's long, it's convoluted, it's expensive, and your doctorate does not get you. We're a green state. It doesn't get you anywhere. Even if we're in a red state, a doctorate still doesn't matter. But it's extra time and money.
Okay.
There you go.
Thank you.
You're welcome.
I just wanna say bye. It was good seeing you.
It was excellent to see you, buddy.
I was gonna tell you, Emily's having her baby next month. Her baby. I know. She got her RN.
Yes.
And so she's living in California.
Oh.
Her husband's in the Air Force, so they're on the base in Sacramento.
Okay, that thing better not still be taping me when I'm cussing. Tora said hello.
I will.
Congratulations.
I just had to tell you.
I love it. I love it. Good for her.
Alright, so I am indeed pretty confused about all the acronyms. I was really interested in the surgical assistant. So surgical tech is
Yes.
below RN, right? It's like a
Yes.
totally separate thing.
It is.
Now,
It
what-
is absolutely a different program, and they have it here.
And you get less pay, less opportunity to move around for surgical tech, right? Just so I read online that if you're
The thing for surgical tech is Rockland. But you have
similar
to.
to RN, same? Similar, okay.
So you have to be certified. So you have to go to a surgical technologist's school. This is one of them. And you get an associate's degree in applied science of surgical technology. So it is an associate's degree, so that's a plus. It is a great program where you have to get hands-on experience in the operating room. That's what you're doing. The clinical rotations, when you start, doing your experience for school, it's in the hospitals. So we've had a lot of, and we waited a long time to get a surgery tech program in medical. People used to be able to be grandfathered in, but you can't anymore. You have to go through a school, an accredited school. RCC is one of them. They work with Lynn Benton, and like the first year, they had to spend half their time in Lynn Benton and then come back down here.
Yeah.
So now it's not that way. It's the only thing is, it is surgery. You will be on call. You will be on your feet. Yes.
Now,
Well,
what
because
about-
I cussed a couple of times, so I feel like you should maybe back that up.
Yeah.
Maybe like drag the bar the last 5 minutes.
Okay.
It wasn't filthy, but it still was.
Okay.
So no, it's